Okay, so we are talking about language disorder. Language disorder. Okay, so, and we have said that it's all about impairments. You know, when you are not able to process language, when a child is unable to process language, so this child is said to be suffering from language disorder. So, and this can happen. This can happen to, oh, excuse me, I think there's a little problem. Are you seeing my screen, please?
Yes, ma'am.
Okay. All right. I have not seen it. Okay. So what can you see? Are you seeing the document or my YouTube page?
Your YouTube page, ma'am.
It shouldn't be. It shouldn't be. So let me share. I stop
Now your
sharing.
picture is showing.
Yeah. So I'm going to start sharing again so that we have the right thing. Okay. Sorry, what can you see now?
The model.
Yeah, we can see the module, ma'am.
Okay, that's beautiful. Okay. So, like I was saying that I want to reemphasize the language disorder in early childhood. And when we talk about language disorder, what are we referring to? We are referring to language impairment. And that is inability to understand and process language either expressively or receptively. So expressively, if you're unable to express, to give, to express yourself, to speak. Receptively is if you're unable to receive, that's to hear and understand what you're able to share. And this can affect every aspect of the language. So it involves children's failure to process linguistic elements, all the linguistic elements, or some of the linguistic elements. Some children are able to, understand, but pronunciation will be the problem. While some, they cannot even, they can pronounce, they can't understand, they don't know the difference between words. They can't even process at all. So all of these are tagged as language disorder. We say disorder can occur due to different factors. And these factors include
Brain
disorder or injury in the brain or tumor. Autism is another factor, which is a developmental disease of variable severity. It is characterized by difficulty in social interaction and communication, and by restricted or receptive patterns of behavior. So these children that are suffering from autism usually have language disorder, and they can be very aggressive and they can be receptive also. Okay, we have aphasia, which is a language disorder that alters a person's ability to communicate, express, and understand written and spoken language. So we have a number of them. You have them in the module. We have cerebral palsy. We have some problems associated with pregnancy. So, and we also have family history, which I talked about the last time we talked about language disorder, that some children inherited it. Not that because they had bad stress or something or any kind of ailment, but they just found it in the family. They are just slow. I think I gave you an example of a colleague of mine. She actually finished with a first class. Was it? No, a very strong 2-1. And she told me, she doesn't even hide it. She doesn't hide it, that she is very slow in doing things, including speaking. She is very slow. She takes her time and talk one after the other. But, even at that, she inherited that probably, yet she is a high flyer. So family history also can bring about that. And for children that falls into this category, you as an educator, you can encourage them, you can bring them up from that level. We also have types of language disorder. We have receptive language disorder and expressive language disorder. The third one is a mix of both. So like I said, some may be able to, speak, but they won't, they could understand what you say, you receive. Okay, so let me quickly go through that. That receptive language disorder, a child with a receptive language disorder does not comprehend language easily. Receptive. They have a problem understanding the meaning of words they have heard or seen, including spoken words or written words on books or signs. It can cause learning problems. The teacher should cooperate with other professionals to provide adequate remedies. So, you see why I want us to look at language disorder again, because it has to do with you referring children that you found or that you notice that they're having this disorder to professionals, because you don't turn yourself to a professional in this regard. You are to impact knowledge, you are to guide and facilitate learning. You are not a professional in dealing with language disorder. You can identify it, but you can't deal with it. So you can work hand in hand with professionals to provide adequate remedy. Okay, so let's look at expressive. A child with an expressive language disorder has pronounced difficulty in using languages. Pronounced difficulty in using languages. Not everyone, everyone has one difficulty or the other, but this is a pronounced one. The child finds it difficult to express thoughts and ideas. The child can understand what other people say, but he or she has difficulty trying to talk, or is mostly unable to communicate or relate what he or she is feeling or thinking. The disorder can affect both written and spoken language, and children who use sign language can still have difficulty expressing themselves. A child with an expressive language disorder may have difficulty in using words correctly, telling stories, expressing thoughts and ideas, and using gestures. Children love songs, but a child with expressive language impairment will find it difficult to sing, to recite, or name objects. So this is it. Now we have those that have the mixture of both disorders. Mixed receptive expressive language disorder, that is, child that find it difficult both to understand and use spoken language. Now, we'll talk about diagnosing and treating language disorder. Now, here, if you suspect that a child in your class is affected by either expressive or receptive language disorder, as an educator, you are expected to support professional or experienced people in the field, including the parent of the child, for this child to be helped. The child may require specific diagnosis or treatment. So during this diagnosis, we require competent professionals who can engage this child in language communication through the use of toys, objects, pictures, animations, and all that. To facilitate language development and language awareness, this child will be encouraged to be engaged in activities such as craft objects, practice asking, and answering questions. So that is the kind of drilling. So you ask question, you ask the child to respond to the question, and you follow through with the child. And then caregiver or teachers can also be of help, because specialists may advise or give simple activity to the teacher to guide the child in social activities. You as caregiver or as a teacher, you will be involved in helping this child to overcome this challenge. So we have behaviors that may be misinterpreted as language disorder. So according to Otis and Emadunudu, behaviors that can be misinterpreted, among others, are to speak fluently, to speak excessively in the home, the language or English, to refuse to answer questions, when one is confused about similar sounds or similar words, when a child is unable to tell or retell stories, or if the child has a poor recall or use of poor pronunciation, or if the use of syntax and grammar is poor, or if the child does not volunteer, information, like it does not suggest information, that may be a misinterpretation that the child is suffering from language disorder. Not all the children that exhibit the following behaviors are actually suffering from language disorder. So, specialists may advise on simple activities to help the child. And specialists may advise you as educators to guide the child and encourage the child in answering questions and pointing out words. These are the ways you as educators can come in to assist the child suffering from language disorder in collaboration with professionals. So at this junction, I want to ask questions from those of you who have had experiences with children with language disorder. What is the experience like? What were you able to do? Were you able to help that child? What step did you take, apart from what we have identified? Which other step did you take that gave a positive result? And what were the risks involved in dealing with such children? Can one or two just respond? Start by raising your hand, then I'll call you. I like people to interact in my class. I don't like to be the only one talking, And if you have never taught, but you have, a neighbor, you have come across one, maybe in the neighborhood, maybe in maybe where you work, maybe in the family, you've had an encounter with a child with language disorder, you know, they can be very, very demanding and attention seeking. You know, some of them can be very, very reserved. They just keep to themselves. So how can you help them? Or how have you been able to help them if you have never had any encounter with them? If you did not raise your hand, I'm gonna call you. Should I start calling names? So when I call your name, you will mute yourself and respond to us. I want to start with Ibrahim Adijat. Have you ever had an encounter with any child having language disorder? How have you been able to help that child?
Hello, good evening, ma'am.
Good evening.
It's just that I don't have any encounter with those type of children before, but
Okay.
I teach the baby class. So, and normally, you know, children, I don't think you can easily spot this kind of disorder in children of age 3 or
I didn't hear you clearly. You
5.
don't think
Am I
that?
right?
No, I didn't get that very well.
Can we
Yeah.
spot this disorder in children of age 3 to 5?
Can we
I
call
don't
what?
know if, I mean, this disorder, the disorder you're talking about,
Yes.
disorder, can we spot it in the age 3 to 5?
Oh my goodness, your line is breaking. Okay, can you put that in
Okay,
the
that's
chat
the next one.
box?
Okay, I'll do that.
Can you put it in the chat box, please do? Because
All right.
I couldn't even share it. Yeah, thank you.
Okay.
Okay, so I will read out your question on the chat box. Okay. All right. Comfort, thank you for bailing us out. I want to hear from you. Go ahead. Unmute yourself.
Yes, good evening, ma.
Go ahead, good evening.
Good evening, ma. This is Comfort, ma.
Yes, please go ahead.
Yes, ma. I actually have a case of a boy, and my experience is that both recessive and
Expressive.
expressive.
Yeah.
Yes, the boy is actually having a issue, and as a result of that, as a teacher, we find it very difficult, you know, a situation whereby if you are telling the boy that maybe A is for apple, for instance, the child will find it difficult to get it, because if you ask the child to repeat what you have just said, the child will be able to to communicate or to repeat what you have just said, and that makes in the class they are responding very well. It will make the mother to be
Oh my goodness. Excuse me. Excuse me, please. I don't know if the network is from my end here. I was hearing you clearly, but at the middle of your conversation, it started dragging. So what I was able to get from what you're saying was that you had a case of such a child that had the mixed expressive, recessive language disorder. and that it's been very difficult.
Yes,
But
ma'am.
I didn't hear the other part
Very,
of it.
very difficult.
I want to ask you, for how long have you managed this child? And is it just one in the school? And for how long have you managed him?
The boy joined us from KG1, and right now the boy is in nursery 2. So recently I told the mom that the boy cannot be promoted to basic 1 because he's far, far back compared to other classmates. So, but though the boy is trying to come up now, because I use the method of sand trail and close close communication. What I mean by close communication, I will call the boy personally to
One-on-one,
myself and
one-on-one approach.
one-on-one,
Okay.
yes, and
So
make promises to
don't you
him
think,
that if he can do this, I will.
some kind of
Hello,
positive
ma.
reinforcement? So you apply also positive reinforcement. Okay. Okay, so I want to ask you, don't you think it is safe? Don't think it is safe to refer this child to a specialist? Don't you think it's safe to refer this child to a specialist so that this child can really be helped and you will follow proper guidance in helping this child? Because you are not a specialist in language disorder and you cannot help
Yes, ma.
that child adequately. So I think the best thing for you to do is that, or don't you think so?
I think it's okay. It's just that before now we don't have this knowledge. That
Yeah.
is the
So thank God
yes,
for
ma'am.
schools. Thank God for school.
Yes,
So
ma'am.
now you're in school
Yes,
that you know. All right, that's
yes,
great. Okay. I think Ogechi also has something to tell us. Ogechi, please go ahead. Thank you, Comfort. You can put your hand down. Thank you.
thank you, ma'am. Thank you.
Ogechi, please go ahead. Okay, I think maybe Ogechi is having some internet issue. Okay, so any other person? I think she's here. Okay, so we are listening. Go ahead. Oh, I think Ogechi is having some issues. Okay. So so when you have such experience, it is safe. Okay, yes. Okay, I'm reading. Okay, let me read Adijat's question. But I think the children in age, okay, of ages 3 to 4. Okay, I think she said but I think in children of age 3 to 4, this disorder can't easily be spotted because um they are still what's happening. Okay, they're still learning how to speak properly, which can improve as they grow. Yes, yes, but not absolutely. Okay, so I think what Adija is trying to say that in children of ages 3 to 4, it might be difficult to spot out language disorder because the children are also coming up to learn how to speak. But I tell you that you will be able to know when you discover that this child is not like every other children in your class. So you want to pay attention. It's not like sometimes it is not so obvious, but when you pay attention as a caregiver, as an educator, you will be able to figure it out. You'll be able to figure it out. Ideally, by age 3, you should be able to know when a child is having speech impairment at age 3. The child may not be able to fluently speak at that age, but the child should be able to speak sequentially having, cohesion, having coherence in speaking. So at that level, you will know. Or if a child is unable to understand, or the child is not able to even hear what you're saying, then you know there is a problem. And then you begin to pay attention, because you don't just say, oh, with the way you have said it, with what you are doing, I know that this is a problem. You will now pay attention, you will now observe that child to be able to spot out what the problem is. Is it just expressive disorder or receptive disorder, or both expressive and receptive disorder? Until you pay attention to observe this child, you may not be able to say that this is the problem of the child, or the child have a problem, is having a problem or not. Like I told you of a colleague who actually did not have disorder, but it's just a nature. So we have children like that too. So it's for you to study. Okay, so I have another comment or question in the chat, but from Christina Ogechi. Okay, yeah, Ogechi. So she said, I worked with a child who can't pronounce words properly, but began to use a method called speech training, and it was better. Not being able to pronounce some words properly, it doesn't mean the child has speech disorder. Yeah. So sometimes speech disorder has degree. It has degrees. So like I said, it's after you must have paid attention to really observe before you can say. Because some children, because of the kind of environment where they grow, may not be able to pronounce some words adequately. So as a result of that, you can't conclude that they have speech disorder. You can't conclude that they have language disorder until you have observed them over time and you have been able to say categorically that this child is having impairment in this area. So on that note, you need to first and foremost observe, critically observe, pay attention, so that you will be able to categorically say that this person is having speech disorder. It's a medical condition. It's a medical condition, and it requires experts' input. But you can talk about your suspicion that, okay, over time, I have checked and I have discovered that XYZ is the situation. But I am recommending that experts should look into this condition and see if indeed I have observed well. You are a teacher, you are teachers. So you're not expected to take up the work of experts in speech disorder. So, okay, Promise. Yes, I can see Promise hand is up. Promise, please, can you go ahead with your comments about your own experience on what of the topic that's before us?
All right. Actually, I will be speaking from the aspect of a specialist. I'm an occupational therapist.
Oh, that's great.
I want to
Oh, well, we're having this.
aspect.
Okay, Promise, can you please retake
Am I
it?
being
You said you're an occupational therapist, and that's fantastic. So, and you want to talk to us from the angle of specialist, but your line is cracking. But we want to see if we could manage.
Can you hear me?
Okay, go ahead. I can hear that question.
So I wanted to write you for being out of
Oh,
it. So from the
Promise,
therapist,
I couldn't hear you. Okay, I think it's getting clearer. You said from the therapist point of view, is that what you're saying? Okay, so I think Promise is having some challenges with her internet, or here is internet, but I think I'm seeing a question here that says, is there a question? Okay, say, good evening, ma'am. Can tongue tie cause language
now
disorder?
these are the things that I've been observing from this child. But if it's not well documented or there's no proof of that, we have to observe.
Oh, fantastic conversation, but your internet from that angle, from your end, I think it's not stable at all. So Promise, we are not really getting the details of what you are trying to give to us. And I'm sure that will have been a very, impactful contribution. Because from the point of view of specialist, a therapist, okay, so let me move on because it's almost time. I want us to stop by 7:30. Okay, so I'm hearing that it can tongue tie cause language disorder. Yes, a small number of children may have language disorder based on tongue tie. But tongue tie usually happen to, babies. It's common with babies than toddlers. So, but we have a level of children may have speech disorder as a result of tongue tie. It's very possible. It's very possible. I don't know. I think what Promise was trying to tell us is a bit lengthy, and I don't know if he will be patient enough to type or in a kind of summary of what he or she. I think that the voice I heard sounds feminine. I'm sorry if I'm wrong. So I'm going to be using they so that I don't get you offended. Okay. So if you can type what you're trying to tell us, you can summarize it. Okay, so we will appreciate it. We will appreciate it. Okay. So I know to summarize what we have been discussing, I just want you to settle it in your mind that no matter how skillful you are, no matter how zealous you are with your job, no matter how compassionate you may be, when you have clinical issues, kindly make referral. Kindly flag it immediately. Don't think you can manage it. Talk to the school head, talk to the school administrator, talk, if you with the permission of the school head or school administrator, discuss with the parents, call the parents' attention. Some children will not be able to express that condition at home, probably because the parents we go to work as early as 6 a.m. So by 5, we just get the children ready. There is no room for interaction and communication. So, and by the time they are back, parents getting back so late, they don't even know what happened. Maybe the child is asleep by the time the parents are back. So they may not know what that child is passing through, but you that spent so long time with the child, especially during the most active hours, then you will be able to say XYZ are what your children or your child exhibits. Then this will call the attention of the parent to swift remedy or cry out for remedy. So don't you ever consider yourself as the therapist that is willing to go all out in order to help. Don't you do that? So what you are expected to do is to what? Tell the school head, okay, please, if you can tell us more, I'm interested. Promise, I can see that you have internet
Yes, ma.
issue.
Ma,
I
is it
don't
very
know.
clear now?
I think it's clear now. So I'm interested in what
Okay.
you are trying to say.
So what I was saying is that because my workplace, I do observation. So if you have any child with language disorder that is coming for therapy, so we
Okay.
notice that most of the teachers, they don't document what they observe. So we always advise that they document that, okay, this child, maybe I gave the child an instruction and
Not
so they have to
again.
document it.
Okay.
They have to document it and also that exactly what the issue was at that point. So I'm speaking from the teacher aspect. Most of the time, the teacher always that it happened. So that's from the teacher
Can you retake that?
talk
That
about.
most of the time, can you retake it from most of the time? The line
So
was,
most of the time, some
yeah.
teachers don't document their observation.
Okay.
Yes, so and which will be required even if the child is recommended for to see a specialist.
Oh, okay. I
So
agree with you.
even if they did not do that, we are going to send an assessment, like a questionnaire. So they have to
Yeah.
fill it. So that's what we do first before we now do assessment for the child. And also, I wanted to talk about the age that it can be detected. So it can actually be detected from 3-year-old, 4, 5. It can't be detected, because even if the child is not expected to be speaking all the receptive and everything, if he's not speaking like that, at least a child should be able to name things. Should be able to understand when they say this is apple. He's able to understand some words, even if it's just single words that the child is
Yeah.
saying at the age of 3. Even if it's single words at the age of 3. So that from there you can observe those things. That's like preschool age, that 3 to 4. Preschool 1, so you can detect it. That one you can detect. And also, I'm currently working with like about 6 children with language disorder. So what we do is basically therapy. So of course, it's a lot. And if you need to work with that kind of a child, let's say I communicate with teachers, and then most of them are not patient enough to work with the child. So there are activities recommended, like you said, recommended to them maybe weekly, that you need to do this. For example, you need to say that you need to practice greeting with a child. Please let this child greet 5 teachers in school today, and this is what the teachers should say to them, so that it will continue. Some might be that the therapists are working from home with the child, or some might be in school, or some might be a recommendation to their parents that when this child gets home, I want you to send this child on an errand, or ask this child so question, where is my bag? Because I'm working with WH questions. So those are the activities we do. And of course, there are a lot of prognosis. There have been a lot of children that are now speaking, they are now talking, but we need a lot of patience. So, but sometimes, the world now, even the parents are not patient enough. They don't want to, like, what's going on? Why is my child? They're so bothered. But when they understand, or they speak to a specialist, they'll be able to understand that they don't need to rush the child. The time that the child is supposed to acquire that knowledge, that languages, the child did not acquire it. Because we have most of these children, they don't have someone to talk to. Their parents are not even communicating with them when they were so small. Or they might even say they talk too much, they will shut them up. So all these things, there are a lot of it. But when they see a specialist, when you recommend a specialist, make sure that you have documented some things and the dates those things happen. So that's what I want to say. Thank you.
Thank you so very much, Promi. This is fantastic. Like I said, without you paying attention and adequate observation, you cannot conclude that the child is suffering from speech disorder. And this observation must be documented. Thank you so much, Promise. I really appreciate that. Just like you are a therapist, I'm also undergoing some trainings on therapies, and but not occupational therapy anyway. So it's quite interesting when you're passing through therapy training, irrespective of which one. It tells you how to listen, how to be patient, how to document, because you must document your observations, your findings. You must document, and that tells you, that will suggest what kind of therapy to, to recommend to the client. So this is fantastic. This is a very, very constructive contribution. I really appreciate it. So teachers to be or will be teachers, because early childhood education, you're being trained to be a teacher of preschoolers. So you must also improve on your patience, your patience as a virtue. Patience is a virtue, but we all have a level of it, but we must always improve on it, especially dealing with children. Children can be something else. Children can frustrate. So if you're not patient, you won't be able to handle children adequately. You won't be able to support the children as expected. You won't be able to figure out where there is a problem in order to recommend the way out, either by you re-strategizing or by you recommending that child or those children to specialists. So on this note, I want to draw the curtain here, and I hope we maintain Friday. Is it 6 or 6:30? The class rep, are you here? Is our class rep here? Okay, so please kindly tell the class rep to chat me up so that I can mark this on my calendar. We're meeting every Friday from now till when, and what time are we starting? 6 or 6:30, so that we can keep to time. Thank you so very much for your time. Thank you for your contributions. Thank you for making the class interesting. I appreciate you. Oh, Fridays, yes, Fridays, what time? Time, please. No, you keep changing your timetable, and that got me worried. Okay, 6:30 is fine. Thank you. So we meet next Friday, God's willing. Have a pleasant evening.
Thank you, ma. We appreciate it.
Thank you, ma.
Thank you.
Thank you.
I thank you too. Thank you.
Thank you, ma.
Thank
I
you,
enjoyed
ma. Bye.
Thank you too. Bye. So you can
Bye.
visit my YouTube page to have this lecture back there.